In this video, we're going to explore the idea of what's come to be known as holiday heart syndrome. And before you get too excited, it's got nothing to do with holiday romances, nor is it a rare tropical heart disease affecting those visiting exotic destinations. So let's have a look at what it really is. Holiday heart syndrome is a term used to describe acute cardiac rhythm disturbances triggered by excessive or binge alcohol consumption in those with otherwise structurally normal hearts. Its name comes from the classic timing around holidays, celebrations, or even weekends. Whilst it is a recognised and accepted term by a number of major medical bodies, it's not a formal standalone diagnosis, and I rarely, if ever, see it used or documented in modern medical practice. It's somewhat more colloquial, but still does represent an important disease process. I thought it would be rather interesting and topical to cover given the time of year and the fact that I'm in the middle of my video series on atrial fibrillation. The term was first used in an article published in the American Heart Journal in 1977 by Philip Ettinger and colleagues at New Jersey Medical School. I love how their paper was rather fittingly accepted for publication almost exactly 50 years ago to the day on the 5th of January that year. The group described 24 patients who had recent heavy alcohol consumption and developed arrhythmias, mostly fast or paroxysmal atrial fibrillation, but also atrial flutter, frequent atrial ectopics, atrial tachycardia, junctional tachycardia, and even ventricular tachycardia. Most patients were admitted after major public holidays, including the New Year, or after a weekend on a Sunday or Monday. The group investigated the patients, and a few patients had transient electrolyte disturbances, such as hypokalemia, and when back in sinus rhythm, ECG analysis of these patients showed prolongation of the PR, QRS, and Q2C intervals, but echocardiography and cardiac catheterization confirmed no significant structural, functional, or coronary abnormalities. The group concluded that these patients had suffered from a newly described clinical entity called the holiday heart. Since then, a lot of research has been done to look at the connection between alcohol use and arrhythmias, and it's true to say that although the term holiday heart syndrome is not specifically used in either the American College of Cardiology/American Heart Association 2023 guidelines, nor the European Society of Cardiology 2024 guidelines on AF, both guidelines do discuss alcohol's association with arrhythmias and reference a number of related earlier papers that do use the term. And on the topic of alcohol, do you think you could do me a quick favour and help that like button get absolutely smashed? I promise there are no side effects, that we know of, and it does really help out small channels like mine. So what do we know about alcohol's influence in causing arrhythmias? Acute alcohol intoxication commonly increases heart rate within a few hours of consumption and can cause a sinus tachycardia of greater than 100 beats per minute. During the hangover phase, i.e. 12 to 36 hours after intake, the most common clinically relevant arrhythmia is AF. Alcohol is thought to be a precipitating factor in around a third of acute presentations with fast or paroxysmal AF. There's no single pathway, but rather a combination of conditions that make AF and arrhythmias more likely. With regards to AF pathophysiology generally, we think about factors which increase the susceptibility of the atria to develop or sustain AF, called substrates, and factors which initiate AF in the first place, called triggers. Think about substrate as the fuel for the fire and triggers as the spark that causes it. AF substrate often involves electrical or structural changes in the atria, while triggers involve premature atrial ectopics or signals from the pulmonary veins. When these signals are conducted into vulnerable atria, AF can result. Alcohol provides both fuel and sparks for the AF fire. Firstly, alcohol is thought to produce dynamic swings in autonomic drive. There is initially increased sympathetic and catecholaminergic drive, which increases firing from the pulmonary veins and the tendency for atrial ectopics, both known triggers for AF. Later, in the hangover phase, there is increased parasympathetic response, which can promote vaguely mediated AF, which is often nocturnal. Next, alcohol is known to cause electrolyte derangement, including hypokalemia, due to the diuretic effect and any vomiting from excessive drinking, and hypomagnesemia. Both can trigger atrial automaticity, i.e. atrial ectopics. Even mild electrolyte derangement can be an important trigger for AF. Next involves the direct effects of alcohol on cardiac electrophysiology. Without going into too much detail here, alcohol affects cardiac ion channels in a way that slows conduction in the atria and shortens the effective refractory period of atrial cardiomyocytes, which means the time before which they can be activated again after generating an action potential. The net effect is to increase the chance of re-entry circuits, which are classically thought to be a key substrate in atria sustaining AF. Next, although alcohol initially produces diuresis and relative volume depletion, individuals often compensate by increasing fluid intake afterwards, and as a result of activation of the renin-angiotensin system, they get sodium and fluid retention, which can cause excessive atrial stretch, which is also a known substrate for AF. Alcohol also interrupts normal sleep architecture, which can activate sympathetic pathways and further increase pulmonary vein ectopy. Finally, AF may also cause an inflammatory state by inducing reactive oxygen species and causing the release of inflammatory cytokines such as IL-6 and TNF-alpha, which can sensitize the atria to arrhythmias. So, to summarize the so-called holiday heart, it's a condition characterized by acute arrhythmias, mostly AF, induced by recent heavy alcohol intake, but in the absence of any significant or long-lasting structural changes. It usually resolves spontaneously, but at least a fifth to a third of patients will develop AF again in the next year. Chronic alcohol intake can have other long-term effects on the heart, such as dilated cardiomyopathy, but that is not part of the holiday heart syndrome itself. So, how would you go about managing a patient presenting with atrial arrhythmia after heavy alcohol intoxication? Well, pretty much the same way as you'd manage any other patient with an atrial arrhythmia. Check out my Fast AF video for more info if you're interested. Treatment should generally focus on symptom control, for example by using rate control agents and considering anticoagulation. More than 90% of atrial arrhythmia episodes are thought to resolve spontaneously within 12 to 24 hours of presentation when triggered by acute alcohol intake. You may want to pay particular attention to ensuring electrolytes, especially magnesium and potassium, are adequately replaced and that alcohol withdrawal and vitamin deficiency, especially thiamine, are treated effectively. And it may help to tactfully suggest to your patient that they may want to avoid binging alcohol in the future. So that's all for now. I hope you enjoyed this slightly more light-hearted video and found it to be educational and entertaining. If you'd like to see more like it, feel free to binge my other videos. I promise they won't mess with your cardiac electrophysiology. See you next time.